Okay, good afternoon, everyone, and thank you for joining us today for the latest edition of our Alberta SPORE Knowledge Translation webinar series. My name is Denise Thompson, and I am the Associate Director of the Alberta SPORE Knowledge Translation Platform. I'm delighted to welcome you to today's session, which is titled Research to Practice to Research, Using Diverse Knowledge Translation Methods for Improving Pain Treatment During Painful Procedures for Infants and Children. Our presenter today is Dr. Denise Harrison from the University of Ottawa Children's Hospital of Eastern Ontario. Dr. Harrison's program of research focuses on improving pain management for sick and healthy infants and young children. Her research questions have often grown out of her clinical work, and her research encompasses knowledge creation, synthesis, dissemination, and translation. Her latest studies evaluate the effectiveness of using social media to disseminate research knowledge. So just before we begin, I'd like to mention that this session is recorded, and the link will be provided for the recording to you along with the presentation slides after the webinar. So the format for today's webinar will be about a 35 to 40 minute presentation, and after that there will be time for your questions. So you can send questions throughout the presentation by using the chat feature at the bottom of your screen, and Dr. Harrison will take these questions at the end. So there will also be some polls during the presentation itself, soliciting your feedback, so stay tuned for those. So I hope you enjoy today's session. On behalf of the Alberta SPORE Knowledge Translation Platform, I welcome Dr. Denise Harrison, and will now hand the microphone over to her.
Okay, thank you very much, Denise, for the introduction. Now, can you hear me okay? I feel as though I have an echo. You can hear me okay, perfectly. Okay, so the title, as Denise said, is Using Diverse KT Methods to Improve Pain Treatment During Painful Procedures for Infants and Children. So before we start, I'm actually going to open the first poll. As researchers, we're encouraged to use social media in our knowledge dissemination efforts. So I'm wondering if you use any social media in your efforts, and if so, Facebook, Twitter, YouTube, or others. Okay, I see the answers coming in. Wow, all of you use Twitter. And most use Facebook. Less, about a third of you use YouTube. And just a couple of others. Okay, interesting. All right, thank you for that. So we'll close the poll. So the questions to consider throughout this session, which is mainly focused on YouTube this time, how can we best use YouTube to disseminate knowledge about pain treatment in babies and children? And how can we effectively evaluate the impact of our YouTube videos on the clinically important outcomes of actual use of effective pain measures in children? So I just wanted to let you know how this all came about. So studies upon studies report knowledge to practice gaps despite a lot of healthcare provider education in hospitals and community health centres. And also by accident. So while looking for suitable videos to use in my undergraduate teaching class, I teach third-year nurses paediatric nursing, and so often I go to YouTube to look at useful videos that I can show the students about different treatments or different conditions. And so I was quite surprised to find what seemed at the time like hundreds of videos showing screaming children, screaming babies, screaming newborn babies, having injections of various sorts. And that's despite the evidence in terms of immunisation pain, on sucrose, breastfeeding for babies, and for older children, distraction and hypnosis. So there's a lot of guidelines around in recommending what we can do to reduce pain in children during immunisations. And when we synthesize all that, the 4 key things for babies are injection technique, breastfeeding, sucrose, and upright front-to-front holding. And then in terms of neonatal pain, again, a lot of evidence out there, Cochrane systematic reviews and other reviews, so a lot of high-quality synthesized evidence and distilled evidence in the form of guidelines. And in a nutshell, what the evidence shows us, that procedural pain in babies is effectively reduced by breastfeeding, skin-to-skin care, or sucrose if you can't breastfeed or if you can't do skin-to-skin care. So what I decided was, if you can't beat them, join them, but let's do it in a methodical way. So this research is framed by the knowledge to action cycle, which I'm showing you here. And this is a cycle that's actually been endorsed by CIHR and developed by Ian Graham and colleagues. So if we look at the knowledge creation triangle in the middle, we go from knowledge inquiry, so they're your randomized controlled trial type studies, down to synthesis in the terms of systematic reviews, and then down to products. I'm just going to talk to you about systematic reviews in the field of using YouTube. And so what we did was, with help of our librarian at CHIO, Margaret Sampson, we developed a method for studying consumer health YouTube videos. And so we did a systematic review of methods, and then we developed our own methods and our own protocol. And then we actually did a systematic review of pain management practices during immunisations. And basically what this showed was that there are a lot of videos out there, as I suspected, but very little, or none, in fact, were using recommended pain management strategies. So we really used that evidence and then decided to develop products and tools targeted at parents of children, because as I said at the start, there is actually a lot of a lot of studies that have tried to impact on the use of these strategies targeted at healthcare providers. So what we did in October 2013, we posted our own video. So this was targeted at parents, showing parents how to reduce pain in their babies during vaccinations. So we developed this in partnership with parents, and we had a 2-month-old little Lucas getting his 2-month needle while he was breastfeeding, and we had a 6-month-old Samuel getting his vaccinations while he was being given sucrose. Our launch coincided with the 2013 flu vaccination campaign, and this was a brief video, 1 minute 35 seconds in duration, and very simple captions in French and English. And so this had no real audio to speak of, and we made it look like a video that was actually posted on YouTube by parents. So we didn't want this to look like a teaching video as such. We wanted this to look like a consumer video, but yet it was targeted at parents, very simple, showing what they could do. And so I've given you the video link, and you can go into this, and I'll follow up with what we're doing in this video at the end of the presentation. But in terms of our launch, we launched this video on YouTube. Near the end of the video, there was a link to a viewer survey. So they could click on the survey. We had a big click here. People could click on the survey and go in, and we had very simple questions about, had they used these strategies before, and do they intend to give sucrose or breastfeed. And then we did this big media campaign very organised knowledge dissemination strategies about this video, and including this poster that I've given you here. So, and then we went on to evaluate the reach and impact of the survey responses. So in terms of results of our reach, so over 68,000 views, so we had a lot of views, but yet the average view duration was only 1 minute 3 seconds, so people were only watching 2/3 of the video. There are a lot of comments, a lot of likes, but the survey response, the survey was completed by only 162 participants, so 0.24%. So at that time, I awarded myself the first prize for lowest response rate ever, and here's my big gold medal, which is not a great thing, but still, it just shows, it gave us a little indication that using YouTube to collect data may not be a worthwhile attempt. So we're going back to the polls now. So I wanted to pose the question, did you view this video? And if yes, did you view it all the way through? And did you complete the survey? Okay, so just getting the answers in anyway. Okay, so most of you didn't see the video. So that shows that despite this knowledge dissemination effort, and obviously the people on this call are interested in this area, which is why you're on the webinar, and you didn't see it. So once again, we know that we can get widespread dissemination, but it still doesn't capture everything. But yet all of you who did see it did do the survey. Thank you very much. You were one of the very few. So that really taught us a few things about using YouTube. But we wanted to try again. So this time we were aiming our YouTube videos at the neonatal population. So once again we went back to our parents and worked with our parents to produce a video that showed a little guy breastfeeding during his heel lance, a little girl being held skin to skin during her heel lance, and another little guy in hospital having blood taken by venipuncture, and his dad was actually there during the filming and was the one giving the sucrose. So this was our YouTube take 2, so we really targeted this again at parents, showing how they can breastfeed, hold their baby skin to skin and use sucrose for newborn infants during blood work. So the first version was bilingual, so I decided that as French and English are the official languages of Canada, and I have heard what I felt were really effective videos that were bilingual, swapping from French to English, and I felt it was a really effective strategy. And so I did this for these videos, and I can tell you this was 7 minutes, and I love this version. I actually thought it was beautiful. But then again, I'm not the one that needs to use this information, am I? So we piloted this video with healthcare providers in Ontario and in Edmonton, and also 50 parents in the CHIO neonatal intensive care. So what did they think about it? Results of healthcare providers were so bored. They just fell asleep, they were frustrated, they were bored, they were fidgety. And the parents also, they said, was way too long, and please, please, everybody said please separate out the English and French. And otherwise they loved it. The feedback was it was persuasive, it was useful, it was important. And in terms of knowledge too, they said they would use either strategy next time, well, breastfeeding, sucrose or skin to skin, and would recommend the video to other parents. In terms of this pilot showing parents the video in the neonatal intensive care unit, it was feasible to enrol parents and show the video in a timely manner. So we took all this feedback and we redid the video one language at a time. And at the time we also did this video in other languages. So we now have 8 languages, and our Portuguese video, we've also just finished a pilot study in a neonatal intensive care unit in São Paulo, and we had 100 parents, and just interestingly the consent rate was 100%. Just to look at the video, and the results were the same that we had for the English and French video, that it was persuasive, it was useful, it was feasible to show in a timely manner. We also produced the video in Mandarin, Spanish, Arabic, Inuktitut, and also German. So then we went back to look at the reach and impact. Just so far I'm just presenting you the English and French results after 1 year. So again we had a lot of views, especially in English, and I've given you the top viewing countries there, so different for French and English. But even so, we still had very few surveys. So for the English video, 1.8% response rate compared to the views, and in French 1%. And still the view length. So only 43% of the English viewers viewed the whole video all the way through, and for the French viewers they only viewed the first third. So again, we've actually said this. We're going back to this question again. Have you viewed this video? And if yes, did you view it all the way through, or did you feel it was too long? And did you complete the survey? Okay, so thank you again. Most of you haven't seen the video. And if you did, the few that did, you didn't do the survey. Okay, so once again that really highlights to us that using such a venue as YouTube is not a good way to collect data about actual use and other outcomes. But overall, we had very large reach. We still don't know the impact of people actually using this information. And we had positive feedback about the content and about the style of the video and the information that we had in the video for most, but not everybody. So one group that we didn't have such good feedback for the first video was the Baby Friendly Initiative, so BFI. So we had pushback from clinicians and BFI due to the perceived non-compliance with BFI. And so we had to go back and really look at what the recommendations for BFI were. So sucrose is not a food supplement, and for babies unable to breastfeed, sucking on a soother can result in an additional calming. So we went back to the drawing board and we partnered with BFI at the national level. And in terms of knowledge translation and thinking of who your team members are, we absolutely should have done this right from the start. So it's not enough to do this sort of thing at the end in terms of end of grant or end of project KT. They needed to be partners with us, but I had just missed that out and I feel really sorry. But anyway, we're partnering with BFI now in terms of moving forward with the rest of our projects. So BFI worked with us and requested a clear explanation that breastfeeding and skin-to-skin care are the first choices. And so what we did was we revised the video by inserting an explanation slide. So this is the slide that we inserted into our video. I'll just give you a minute to read it. now I'm just going to play you the video.
When babies need to have blood tests or injections, there are things that we can do to help reduce pain during these procedures. 3 things are most effective: breastfeeding, sugar water, and kangaroo care, also known as skin-to-skin care. Breastfeeding can provide much more than nourishment to babies. It can also help reduce their pain and distress from blood tests. As you can see in this video, the nurse pricks the baby's heel for the blood sample while the baby is breastfeeding. As a mother, you can help by holding and breastfeeding your baby while the blood sample is being taken. In order for breastfeeding to have a maximum effect, it should be started about 5 minutes before the blood test. Ask your nurse or doctors about breastfeeding during blood tests or other needles, as well as other ways you can help babies during painful procedures. Kangaroo care can be done by mothers or fathers and is most effective for newborn babies, especially preterm. The babies are held skin to skin against their parents' chest. As you can see in the video, the baby is wearing only a diaper and is held in an upright position on the mother's bare chest, tummy to tummy. Fathers can also be the ones to hold their babies this way. To help keep your baby warm, the parent may wear a shirt or hospital gown with an opening in the front and a blanket over to wrap the baby. Having the baby in kangaroo care helps to reduce their pain and distress from blood tests. In order for kangaroo care to have the best effect, it may be started 15 minutes before the blood test. Ask your nurses or doctors about kangaroo care during blood tests or other needles, as well as other ways that you can help babies during painful procedures. Small amounts of sugar water called sucrose reduces pain during blood tests in babies up to 1 year old. As you can see in the video, the baby is given a small amount of sucrose from the syringe before the nurse pricks the heel, and again during the blood test. Sucrose is most effective when given around 1 to 2 minutes before the blood test, then again immediately before the procedure, and again throughout the procedure every 2 minutes or so until the procedure is completed. Ask your nurse or doctors about sucrose during blood tests or other needles and other ways that you can help babies during painful procedures.
Okay, thank you, Jana. So now we come to where to next. So point 1, we're pretty confident that our videos are useful knowledge translation tools in multiple settings around the world. But to test effectiveness in change in practice, we really think we need to combine social media studies with traditional randomized controlled trials. Like, for example, does a parent-targeted or parent-mediated video increase use of pain reduction strategies during newborn screening? So we're just going to come to another question now. Do you think such parent-targeted, and targeted really means that we're targeting parents to take action themselves, or mediated, where we're hoping or targeting parents to actually change healthcare provider practices, can result in practice change? So if you say yes, think about how, and is this likely to actually be parent-driven, or is it actually more likely to be healthcare provider-driven, or do you think it's both? And we'll just keep this poll open for a bit longer. Okay, so most of you are saying both. Okay. Okay, that's really helpful to know. Thank you. And we're just having a question being asked at the moment by Robin. We might come back to that. So now where to? So I've given you the link to our vaccination video, but in the meantime there were quite a few things that we realised we really had to work on. And so we did actually receive CRHR funding to produce a new vaccination pain video. So showing recommended rapid injection and no aspiration technique. And we decided this time to do 2 separate videos rather than one for sucrose and breastfeeding. And this is based on the new World Health Organization recommendations to use breastfeeding during infant immunizations, but not sucrose. And that's because sucrose does have a cost, it's not always available, and it could potentially involve water, so we're not always confident of the water safety, whereas breastfeeding can be encouraged in any setting. We also know that these are parent-targeted but useful for healthcare providers. So I'm just getting to Robin's question now, which is, why did you decide to target parents and not healthcare professionals with the video? And the reason why is because there's been so much healthcare provider or healthcare professional education already done. But even though we targeted this at parents, I've actually had a lot of feedback that it is helpful for clinicians as well. So now you're asking, if you were to create a video for healthcare providers on reducing procedural infant pain, how would it be different? And that's a really good question, and in fact that's why we're trying to work out with this new vaccination pain video that we're doing. And we're wondering, do we have 2 versions? So one, very targeted parents in terms of this is what you can do to help your baby, and showing the recommended treatment, like our newborn one, showing the babies close-up breastfeeding and still having their vaccination. Whereas maybe for healthcare providers, we really need to also show the actual injection technique and the positioning of the clinician, and include much more detail in terms of how these interventions help, what the mechanism is. But think about that, and I'd really like your feedback on this. So I think in conclusion, YouTube is an effective way to disseminate knowledge to a large and widespread audience. but yet ineffective as a means of data collection through link viewer surveys. So I'm not the only one that's looking at this. My colleagues over in IWK, over in Halifax, are also looking at the use of YouTube to impact on pain management practice in babies and children. And they're having the same very low response rate, although when I talk to them I feel as though I still hold the record. But they're coming close, so we're really realising that this is not a way to go to actually collect data. And then the key question is, can YouTube videos effectively translate knowledge into action and actually improve clinical care and subsequent outcomes, which is the whole reason why we're doing this, so at the very end clinical care is impacted on. And the answer, I think, is we actually don't know this yet. We really don't. We just know we can put information out there that can get viewed all around the world, but does it actually impact on practice? But for babies, we really need to move this knowledge into practice, like yesterday. And I would just like to acknowledge my funding and the University of Ottawa, my Be Sweet to Babies team, the CHIO Research Institute and Foundation, and my funding sources, and special thanks to Bonnie Stevens and Mariana Bueno, and babies and their parents, and all the nurses and midwives and lab techs and clinicians that we've worked with. So thank you, and I look forward to opening this up for questions and further discussion. And so, Robin, I'd just like to ask you, so you asked this question, do you have any ideas on this? And do you think, and also for all the participants out there, do you think for this sort of thing we should actually have two versions? So one very public version targeted at parents, and another version that's far more targeted at healthcare providers with more information. So Cheryl asked, did you find Google Analytics helpful for collecting KT data? So we used YouTube Analytics, and yes, very helpful for collecting numbers in terms of where the video, how many views there were, where the video was used, viewed, what countries, how long the viewing times were. Using social media is a bit of a minefield. You can actually pay money and get more analytics. So we decided for the first few not to go there because they're relatively unfunded. So this was done on very low cost, low budget, and we felt that what we could get was sufficient for our purposes. But as I said, it only gives us information about reach and not impact. And so I really think we need to take these studies back to a more traditional trial or survey and combine. So we can ask at the trials or surveys, have you seen this video before, to really help us collect data about the knowledge and the reach and the impact, but still show them at the bedside and collect data about persuasiveness and then look at actual impact on care. So Cassie, it's a really good question. Who do you think is the best target audience to change practice? Parents, healthcare providers, or both? And absolutely we need both. Healthcare providers are traditionally targeted, and as I said, there has been years and years of healthcare provider targeted education about pain management in children, but it hasn't consistently changed practice. And so I just felt that parents were such a key here. We need the parents to breastfeed the babies and hold the babies skin to skin and to advocate for the babies. But yet we're not involving them in pain care right from the beginning, and we're not really targeting them in our education. And so if we look at true patient-orientated research, where in my case, parents of babies are involved right from the beginning in setting the question, developing the method, being active participants in the research process all the way through, not just as an end of grant targeted audience. So Robin, I'm just reading your comment now. It would be worthwhile to create two and then compare the usage. We could then learn a lot about using YouTube for those two audiences. Exactly. Yep, really good comment. So Camellia, what were your success indicators for the YouTube videos? And again, excellent question, because if we think what the real important question is, are these strategies used during HEAL-LANCE, venipuncture or vaccination, depending on the video? And we cannot get that from the YouTube video. So my aim in terms of success of indicators were with the survey that that before we asked parents, it was parent or healthcare provider, we asked, did you know of these interventions before? And most people didn't. But yet after, when we said, after seeing this video, would you actually use these strategies? So that's looking at intent to use. And intent to use was way up 90 and 100% that people would intend to use breastfeeding, skin-to-skin care, and sucrose for future painful procedures. So that was our success indicator. But as I said, we had such a low response rate that can we really say that that this knowledge was something that we could build on? Okay, a couple more comments coming through. So going to the traditional methods, Camellia, are you going to measure impact by the practice change? And yes, we actually are. We're about to start a pilot randomized controlled trial in one healthy baby newborn setting where we randomize mothers or parents to see the video or not before the newborn screening, and then we'll actually collect data on pain management used during the newborn screening, and then we'll actually come back to our control group and show them the video so as they get to see the video too. But yes, we're actually going to look at the outcome of use of pain management. Okay, so really good question. Do you use hashtags when sharing the video? So learning how to use social media has actually been a steep learning curve, and I should have done this in a much more strategic way from the start in terms of using Twitter. And Christine Chambers is who I call the Twitter Queen, and she's taught me a lot about using Twitter for knowledge dissemination. And so she's one of the colleagues I mentioned before that's working over at IWK in Halifax. And she's working with the Yummy Mummy group on improving pain management practices in children. And she has really used hashtags right from the start, and I haven't. And so when we make our new video, that is something we really need to do and promote. Okay, so there's obviously a few more comments and questions coming in. So Diane, some 30 years ago, exactly. Oh, thank you for that feedback. So as I said, we're in the process of making a new vaccination pain video. We actually did some filming yesterday in our local community health centre, So we aim to get another young baby breastfeeding and an older baby having sucrose. And we're working with a team including Anna Taddeo from Helping Kids, who's really done most of the work about vaccination pain in children in Canada. And we're working with BFI, and we have parents on our team, and we actually have children on our team too, to really help us with the messaging as well. Okay, Camilla, you're planning to use a placebo. So this isn't such a placebo in a KT. They either get to see the video or they don't. And in terms of getting consent, the way we've worded it is this project is aimed to investigate the way we care for babies during newborn screening. And so you're saying if the impact is actually mediated by the content. And I think you mean the content of the video. So when I asked before in terms of is the effect or impact mediated by parents or healthcare providers, because in the end we're planning another study where nurses in different settings will show the parents the video. So is it actually them showing the parents the video over and over again because they'll see it, or is it still the parent advocacy? And that's something that I think will be a recommendation for further studies in terms of what actually is it that's resulting in the change, if there is a change. Okay, so a question, what procedure do you recommend for infants who are no longer being breastfed, and sweet solutions? So in terms of vaccination, sweet solutions and upright front-to-front holding, and along with recommended injection techniques, which is rapid injection and no aspiration. And these are recommendations also from the Helping Kids team, led by Anna Taddeo. Okay, thanks Augustina. Thank you for that feedback about that trending hashtag. That's really good feedback, and we certainly will with our new video that we're still in the process of making. Okay, thank you, Robin. Targeting grandparents could be a good audience too. Exactly. And I've had really good feedback from grandparents, actually, and other friends and family members. I wonder if we target them, though. How would we do that differently? And are grandparents as likely to be on social media as much as parents, given the generation? And if so, I'm thinking what sort of ways could we target them that would be different to parents? And again, one of the ways, of course, would be to involve some grandparents of children in our team. So I've been very focused on having parents and children. But you're right, do I really need to go to an older audience as well? So I'm still waiting on a few comments coming through. Okay, so a question about the translation. Actually, I'll come back to that. Thank you, Robin, about grandparents. Survey them first to find out about social media channels. Your guess is they're more likely to use Facebook. Okay, that's a really good point. And you bring up a good point about Facebook also. So certainly YouTube is far and wide dissemination, but very little active involvement in it, whereas Facebook is far more, well, it's very popular, which is important, has a large reach depending on your followers, and is a much more, how can I put it, personal way, I guess, of collecting data. So we have a question about the other languages. So translate the same message in each case. Okay, or cultural adaptation. So again, that's a really good question. So what we do is we send the script to our translators in the different languages and ask them to make it culturally appropriate. So it's not word for word translation at all. It is how would you put it in your language. And one interesting thing in putting multiple languages out and just expecting YouTube to use the same method in YouTube. So our Mandarin version, YouTube is not allowed in China, and so they have a different system, but we couldn't get the video on, and we certainly couldn't get the survey on. It just was not passed. And then in Inuktitut, so every video in terms of the survey and the comments and the background information, we've also put that in the individual languages too. However, for Inuktitut, we couldn't do that. YouTube cannot accept the Inuktitut script. And so, in fact, we had to go back and put that background information in English, although the video itself is spoken in Inuktitut, and the subtext is Inuktitut, but the background information we actually had to do in English. Okay, and that's a great comment, Augustina, about showing the video at doctors' offices, and that's certainly something that we will also look at in terms of the vaccination video once we've got our new version. And we do have a general physician, a family physician on our team, and so that's something that she'll really work with us. And we also have community health centres on our research team. Okay, just getting another comment coming in. Okay, it's a really good comment, making posters that can be mounted in healthcare facilities. So exactly, that's something that we certainly did for our launch of the vaccination video, and we've also done it for the newborn video. So it's really making them widely available. And how do we get to so many different healthcare centres when there's not a very organised way of getting to somebody in charge? It's really going from centre to centre in terms of the private family physicians' offices anyway. But exactly, this is something that needs to be done for sure. What we do on our posters is we give the hyperlink to the video, and we also have a scan code that directly links to the video too. And you'll see in one of my first slides, you'll see an example of one of the first posters that we put out. And we actually did do door-to-door walks and put these in private doctors' clinics, and we put them in public libraries, because public libraries now are a venue for a lot of young parent education about their babies and childcare. We also put them in sports centres. Again, it's a venue for where young parents and their young children go. The other thing about the televisions is the video has been requested by many hospitals for their closed circuit televisions, and certainly we will give the actual video file, so not just the YouTube link, but we send the video file to any hospital that asks us for the newborn video file. Okay, thank you. So it looks as though our comments are coming to an end. And so thank you for, first of all, for inviting me to present, and thank you for participating, and feel free to email me with any comments, any questions, or if you would like the original video file of the newborn pain video sent to you. And please stay tuned for the next version of the vaccination pain video. And anything I can help you with, I'm very welcome. I'm very happy to do that. And again, thank you for participating in this
Okay, well,
webinar.
thank you very much, Dr. Harrison, for that thought-provoking presentation and very practical perspective on the challenges of knowledge translation. Thanks as well to all the webinar participants for joining us today and for your questions and comments on the project. So for anyone who joined in late, I'll just mention again that the session has been recorded, and the link to view the recorded presentation will be emailed to all the participants who registered for the webinar, so stay tuned for that. In the email, we will also include information about upcoming KT platform webinars and provide a link for you where you can sign up for our Knowledge Translation Platform newsletter. Our next webinar will be on April 13th and will feature Dr. Lisa Hartling and Dr. Shannon Scott from the University of Alberta. They will be presenting on mobilizing knowledge to improve pediatric health care. So on behalf of the Alberta SPOR Knowledge Translation Platform, I'd like to wish you all a great afternoon and hope that you'll join us again next time. Thanks.